All right, hello. My name is Lazaro Chavez. Today I'm going to be talking about dFBr, which is a potential therapeutic ligand for nicotine addiction. dFBr, all that is just an abbreviation for the actual drug molecule. Since this molecule is still in the research phases, I'm just going to talk a little bit about the significance of nicotine addiction, the mechanism of subpopulations of nicotine receptors, dFBr drug effects in vitro, and some of the current treatments that we have for nicotine addiction. And here I just wanted to show the expression of these nicotinic alpha 4 beta 2 and alpha 7 receptors throughout the brain. But we're just going to be focusing on the VTA area, SNC, because that's where the highest concentration of these is seen. So I'm pretty sure we all know that tobacco is the leading cause of preventable death and disease in the US. So I just wanted to focus on 2 points here. One, that 2 out of every 3 smokers want to quit, but only half attempt to quit each year. And in 2018, not even 8% of those who attempted to quit succeeded. So this is highly associated with the withdrawal symptoms, and it leads to a lot of relapses. So that's one problem. And the second one is 1 out of every 3 people who have ever tried to smoke become daily smokers. So this is the addictive component. Again, this is the system we're dealing with. These receptors expressed on dopaminergic neurons in the VTA, and their projections into the nucleus accumbens. So, simply put it, they're ionotropic, ligand-gated ion channels. They're 5 membrane spanning units with the beta subunit highly associated with desensitization kinetics. They can be expressed presynaptically, postsynaptically, on glutamate neurons, on GABA neurons, so it has a lot of effects elsewhere. And the one seen in dopaminergic neurons is this hetero assembly with alpha and beta subunits. There's a alpha 7 homo assembly that's indicated in Alzheimer's disease. But what we see here is that this 5th subunit, either it be alpha or beta, has an effect on the pharmacology of the receptor. So this is our molecule, dFBr, and it's actually a naturally occurring metabolite of this microscopic aquatic invertebrate. It's a moss animal found in the northern Atlantic Ocean, and it apparently has a strong lemon aroma, but it's normally attached to rocks at the bottom of the sea and filter feeds, and is food for like sea urchins or snails. So this is washed up on the beach right now. But anyways, this is the normal response seen with the endogenous neurotransmitter acetylcholine, and then the response with dFBr here, so it's enhanced. And this vertical increase here is efficacy versus if this were the effect, and that's more potency. So we're dealing with the efficacy here. And there's 2 ways that you could achieve this, right? You could either increase the peak maximum response of acetylcholine, or you could prolong the duration of the response. So that's what we're going to see here with dFBr. It's a type 2 prolonging the response. And this is therapeutically the goal, because we're trying to manage the desensitization states to alleviate the withdrawal symptoms while reducing tobacco intake. So it's a type 2 allosteric potentiator, and it does this by increasing the frequency and or duration of the channel opening. Has a slightly stronger potentiation for this alpha 4 beta 2, with 3 being alpha versus the 5th subunit being beta 2. And like I said, it increases the efficacy for acetylcholine rather than the potency. And in rodents, it has been seen to decrease self-administration of nicotine and lower the withdrawal symptoms in mice. So this right here is 2 electrode voltage clamp recording. I think they usually do it at like -50 on some frog oocytes. But as you can see here, this acetylcholine, based off this 5th subunit, it has a different response. So this is acetylcholine with the normal response, and then this is dFBr increasing the maximum response in a certain way, being 0.4 here, right there, and then 1.6 right there at the EC50. So some current treatments that we have right now is this nicotine replacement treatments, or NRTs. It's like nicotine gum or the transdermal patches. and it only works for about 20% of the people. So we needed something else, and we got this bupropion, which is Zyban or Wellbutrin SR. It was the first antidepressant approved for nicotine and nicotine addiction, and the first non-nicotine containing drug for this condition, and it acts as a non-competitive antagonist of these receptors. It's about 30% effective. I know this is a small n here, but that's pretty consistent across other studies. And then we also have this other one, varenicline, that's about 35-40% effective abstinence rate, 12-month abstinence rate. And that is acting like a partial agonist here, depicted by this number, and it has less side effects on other nicotinic receptors. So it's a lot more efficacious drug. There's no positive allosteric modulators for clinical testing right now, but hopefully that's the next step for this dFBr or derivatives of that molecule.